today, right, we've gone over already two different pillars, right? Today is the third pillar, so we'll be looking at staffing, so minimum staffing, PBJ compliance, and really, everything that we're doing is talking about really the why behind a lot of this, right? Not just this is what it is, but what is the current landscape, right? What are inspectors flagging? What are they looking for? Because as we know, all of this changes really yearly or more. So, um, if you got a deficiency last year, right? In a lot of cases, that's not hard to see coming, right? We've got all of these areas that Robin's going to walk you through today. Not only what they're checking, but of course, what gets cited, things like that. Now, if you've joined any of our webinars in the past, you know that it's really three things, right? We do this webinar with Robin. We were just talking about before this, Robin and I. She's got a 6 hour course that she's doing for people. So she's one of the most educated people in the industry, most up to date. She works for Celtic Consulting, and so our goal is to give you guys tangible value, useful things, right? Give you tools and a plan, and then of course answer any questions you might have, and we'd love to, of course, get your feedback as well. So this is Robin, right? She hates this part, but
Hate it.
I'm gonna do it anyways. Basically, long story short, she's great. She knows a lot of things. She has a ton of experience, and she's our trusted guide today to walk us through everything. So I'll let her take over. I'll turn my camera off, and then I'll pick back up with you guys a little bit later.
Well, thanks, Tyler. So I'm Robin from Celtic, and I'm also going to shut my camera off because I find it very distracting, and I will come back on at the end to answer any questions. So the third webinar in our series, so we're going to talk about FTAG F725 staffing. So what are surveyors actually looking for? So F725 is all about the minimal staffing. And for those of you who've been following like CMS's memos and stuff, CMS has tried to get federal staffing mandates. And I don't know your opinion on it, good or bad, but they're not going to go into play right now. The final rule that was just passed, I believe it was last Thursday, does not address it either. So I don't think that's a bad thing because we're still in a staffing crisis in some parts of the country. So there is no federal staffing mandate yet. Coming down the road, maybe, but not right yet. So what are the surveyors looking at? So it was rescinded in December 2025, but staffing is still the first thing that surveyors check. So this F725, sufficient nurse staffing, is still one of the most frequently cited FTAGs nationwide. So how do the surveyors know this? Well, we report our staffing on PBJ, which, just a little side note, my friends, PBJ is due next week. I believe it's due the 14th or the 15th, and this is the last time you're going to report PBJ on the old Casper website. Next time you report PBJ in November, it's going to be on iKeys. So if you do not have your HARP account yet, you need to get moving on that one. That's just a little side note. Okay, so they're looking at posted schedules. So everybody knows the posted schedule is that little piece of paper that either sits scotch taped to a door in a little picture frame on the nurse's station when you first walk in. So that is actual daily staffing. And it's always on paper, usually always on paper. But there are regulations around that. So just a little side note on that is if somebody calls out and you did not replace and your staffing changes, you're supposed to cross it out on that piece of paper and put actual staffing. And that piece of paper needs to live somewhere for 18 months because the state surveyors can ask for that posted schedule that the family is seeing when they come into the building to know what the staffing is. So you need to make sure that you have your posted schedule saved for at least a year and a half. And then timekeeping records on every annual survey. So resident outcomes are tied to understaffing, falls, medications, pressure wounds. It just shows a deficiency of care. When we obviously have low staff, we can have more issues with care. And then state minimums remain in effect and are independently enforced by state survey agencies. So I'm a nurse in Connecticut. Connecticut does require an RN in the building 24 hours a day. And there are some states, because the federal mandate is only 8 hours a day, but we're above and beyond the federal mandate. And the staffing domain is approximately 22% of your facility's total five-star rating on Care Compare. So that's a big deal. If you can be 5 stars on your staffing rating, you're going to get a bonus star to your overall rating. So that's what everybody's really looking for. And on this webinar, I'm not going to get into coding PBJ because that is a couple-hour conversation in itself. But we just want to make sure that we're coding correctly. So we're paying the staff to come in, the staffing looks right, we're getting our stars rated on that. Okay, Tyler, next slide. So what's sufficient staffing mean without a federal number? So without a federal hours per resident day mandate, surveyors judge a sufficiency based on your residents' actual care needs. So according to CMS Q4 2024 data, 9 out of 10 nursing homes fall short of expected staffing. 40% fall below the expected RN staffing, and 15 to 25% show an increase of F725 citations for facilities with 0 RN hours. And yes, this does happen. Next slide, Tyler. So what sufficient staffing means without the federal numbers. So the key takeaway is unlike a regulation that specifies a fixed nurse to resident ratio, F725 is outcome based, right? So it's all on the judgment of the surveyors. And I'm going to just say something about that for a second, is if you're nursing leadership, meaning an administrator, a DNS, an ADNS, something that, and the surveyors walk in and you start to panic and show anxiety, that trickles all the way down to your line staff. So if you're showing anxiety, then your intermediate managers and your line staff are going to show it too. You have to be survey prepared. If you're survey prepared when the surveyors walk in, you're not going to show the anxiety. It's not going to trickle down. You're going to be calm. The surveyors are going to pick up on that field because I can tell every time I walk into a building within 5 minutes, I know if it's a comfortable building or not. I can tell just by the way everybody's acting. And the central survey question is, did the facility have enough qualified nursing staff at all times to meet the assessed needs of every resident? So if the residents' needs are not being met because staffing is inadequate, and even if the facility meets minimum staffing requirements, you can get a deficiency under F725. And when we move on in this presentation, I'm actually going to give you examples of deficiencies, different types of deficiencies. Go ahead, Tyler. So 4 things that flag at a facility at survey. So any one of these can send the surveyor looking harder at everything else in the building, and this is the last thing you want to have happen. Obviously, if there's fewer than 24 hours of licensed nurse coverage in a single day. A consistent pattern of low weekend or overnight staffing, and this is all reported on PBJ, my friends. A 1-star staffing rating on Care Compare going into the annual survey, and resident harm tied to understaffing, an understaffed shift, meaning a fall, missed medication, and a pressure wound. And we're going to talk about how you get into IJ territory with that. Next one, Tyler.
Oh.
So the RM requirement that was not part of the rescinded rules. So Section 42 of the Code of Federal Regulations requires, like I said, at least 8 consecutive hours of an RN service every day. And this remains the standard right now. So obviously we have to have an RN 8 consecutive hours per day, 7 days a week. Charge nurse substitution is permitted only when certain conditions are met and documented. RN coverage gaps between shifts are frequently cited. Shift change documentation must be airtight. F727 citation rate for facilities reporting 0 RN hours climbed from 15 to 25%, and that's from the Office of the Inspector General's report back in 2025. And surveyors do verify staffing schedules against timekeeping and PBJ data to confirm RN presence. It's like, again, if you're in a state that requires 24 hours RNs, it's not as much of a big deal as the states that do not require RNs 24 hours. Go ahead, Tyler. So why is PBJ is so important and why it follows you into every survey? And we're 10 years now into reporting PBJ. PBJ audits are still happening by Myers and Stoffers. We're still screwing up on all the PBJ audits. So why are we having a hard time getting this right? So every Medicare and Medicaid certified has to submit. Like I said, we are the most overregulated industry in the United States. Second, we are in front of now nuclear energy. Nuclear energy used to be first. Now we are first. Surveyors have this, they know before they come in. Okay, so they know what gets submitted, hours by job category, employees versus agency staff, and daily staffing counts. And obviously, everybody knows it's due 45 days after the quarter closes, 4 times a year, and it's due next week. CMS uses PBJ to calculate mix adjusted hours per resident day and compares it to expected levels of your acuity. So, also, MDS coding has to come into play here. And the staffing domain on your 5-star rating is updated quarterly, and surveyors pull this before every annual survey, compare it to your schedules and payroll records. Go ahead, Tyler. So, like I said at the beginning, the submissions are moving from Keys or the old Casper site to iKeys. So everybody must register in iKeys before quarter 3 ends this year, which is when does quarter 3 end? September 30th. So the deadline to submit this year is August 14th in the old system. The deadline to report in the new system for quarter 3 PBJ data is November 14th. So you need to get that underway if you do not have an iKeys login yet. Okay, Tyler. So how PBJ feeds your 5-star. So you miss one quarterly deadline. Oh, and this is such a problem. And you get an automatic 1-star staffing rating. So they're automatically going to downgrade you. And they're going to do other stuff too. You're not only going to get downgraded, when the state surveyors come in, you're going to get an F tag associated with it, and it's an F tag at a scope and severity of an F. So there's a lot of points attached to it too. So, I have asked CMS, why are we also getting a survey tag? We're taking the penalty on our quality measures. Why are we also getting a survey tag? Because it's also about transparency. It's about compliance. They want you to do it, and you didn't do it. And it's about transparency. So people can see on Care Compare your staffing. So you missed in both spots. So they're gonna ding you in both places. Weekend staffing is scored separately and weighed heavily in the calculation. Agencies' hours reported separately in PBJ can trigger close surveyor scrutiny. Make sure you get your agency hours correct in there. And then you got to use your Care Compare preview in iKeys to check your scores before the surveyor does. Okay, next slide, Tyler. So what are the top errors that show up at survey? So agency hours are not reported in PBJ. What the surveyors see is PBJ versus payroll discrepancy, and that's flagged automatically. Hours rounded or estimated instead of using timekeeper data. And sometimes this could be due to the payroll system that you use. Some are better than others. Some have multiple decimal points when you report hours and some don't. Data mismatch triggers a records audit, missing or duplicate employee IDs if you're submitted late. And it doesn't matter if you're 1 minute late, you're late, you're not gonna be able to do it. And PBJ hours do not match what you posted on the schedule. So that's what I said. When you're keeping that paper schedule, you got to make sure you're keeping it correct. Go ahead, Tyler. So what are inspectors flagging so far from January in 2026? So PBJ versus schedule mismatch, like we've talked about a few times here. Gaps are deficiencies. Outcomes on understaffed shifts, a fall, a missed medication, a new pressure wound is tied to a shift with low staffing. Weekend and night RN coverage. So I'm going to talk about this for a second. I get it. Weekend coverage sometimes is tough in a building. Night coverage is tough in a building. When the surveyors come in and they suspect a staffing issue, when they come in and talk to your line staff, they're first not coming in to talk to the administrative staff or even the RN on the unit. Who they're talking to, and it's right in the critical element pathways, they're talking to housekeeping. They're talking to maintenance. They're talking to that type of staff because what they're asking is, Do you notice any change in staff on the weekends? Do you notice the residents staying in bed later on the weekends, which would suggest that there's not enough CNAs? Do you notice odors in the building on the weekend? These are the questions, if you're nursing management online or ownership, you should be taking those critical element pathways, using it as a huddle, going out there and asking the maintenance, the housekeepers, the CNAs, those questions and see how they answer. Because so many times when I was a DNS in the building, the call bells are going off and everybody's yelling and families yelling, and you're like, okay, what do they do? You kind of go out there and you hear the CNA saying, well, we're short staffed today. We had 3 CNAs call out, so too bad, I'll get there when I get there. And I sit there and I cringe because now what they're doing, when you hear your staff saying that, your staff is angry and not being heard. So when a surveyor comes in, who do you think they're telling? They're telling the surveyor. So if you're out there as nursing management, going to them, making sure that you're hearing their concerns, saying, yes, I realize we're short staffed. I am trying anything I can do to help you. Have your nurses help the CNAs answer the call lights. Everybody should be answering the call lights when you're a little tight on CNA staffing. So your staff feels appreciated, feels heard. So when the surveyors are coming in, their staff isn't like reiterating to the surveyors their frustrations. Okay, Tyler, next slide. So what do they request on day one when they come in? They usually request these on arrival. And if you're disorganized, they're gonna look deeper. So where's your daily staffing schedules, posted and actual for at least 90 days prior to the survey, but they can go back a year and a half. PBJ submission confirmations for the last 4 quarters, your on-call logs and variance documentations for any shifts that ran short, your agency and contract staff logs showing actual hours worked by each individual, your licensed nurse signature logs or timekeeping records, and competency records of training and documentation for any agency staff used. So, my friends, if you're using agency and you use long-term agencies like 12-week contracts, they need to be part of your skills fair. If they're not, you're missing the mark there, because how do they know your policy and procedures? Going to give you an example. If you have issues, with pressure ulcers in the building and they know that you have a staffing issue, they're going to come up and ask one of your CNAs, what's your policy and procedure for preventing pressure ulcers? And if your CNA, so I don't know, that would not be the right answer. If one CNA says, well, we turn and reposition everybody 2 hours per facility policy, what they're doing there is saying it by memory, meaning that they might not actually know what the policy and procedure is. They're just memorizing it. If they ask CNA number 2, how do you prevent pressure ulcers in this resident? And the CNA says, what we reposition Fred every 2 hours, and we're making sure that we're checking Fred for incontinence. We have a toileting scheduled program. So when somebody's answering a surveyor that way, the surveyor has confidence that that CNA understands that resident is using critical thinking and making sure they're using proper measures to prevent pressure ulcers. Both answers are right, but one answer is better that actually shows critical thinking instead of memory of memorizing a policy. Go ahead, Tyler. So federal minimums are gone. Like I said, you might have opinions on this. I do too. State rules still apply. So what the state regulates is total nursing hours per resident day minimums, and several states exceed the rescinded federal rule, which Connecticut, where I practice, does, are in an LPN distributions requirements by shift level and acuity-based staffing minimums. And does everybody know where the acuity-based comes from? The MDS. And rural hardship provisions, and there are waiver processes in place for that. So what does it mean at survey? That state survey agencies enforce state minimums independently of any federal standard. The CMS Form 2567 can and does cite state adopted staffing standards. Facilities in high minimum states are held to those numbers, not the federal floor. And know your state's exact requirements before your next survey. Okay, Tyler? So, what a survey ready staffing system looks like. So, the difference between a facility that gets cited and one that does not is almost visible, is very visible. Like I said, you can walk into a building, I can walk into a building, and I can tell in 5 minutes how it feels. And so can a surveyor. So, open shift gaps are visible before, make sure you're identifying this before care suffers and the surveyor sees the outcome. PBJ data matches the timekeeping records, the schedules, and payroll every quarter. You've got to reconcile, my friends. And for everybody, if you're in a larger building and you're waiting for 3 days before the PBJ deadline to reconcile, there's going to be mistakes. My larger buildings, we reconcile payroll every week. You know what I mean? So we're not sitting there at the end of a quarter with a surprise. Agency hours are tracked and reported accurately. And I know I'm giving you this statement, and this is the thing that gave me the hardest trouble because, you might have an agency just of 1 day use and then another agency of 3 day use, and you're trying to remember where you got them all from, get the PBJ orders, hours from them. Not easy because some people don't have agency clock in. Staffing patterns are reviewed monthly in QAPI. Weekend gaps are reviewed in QAPI. RN night coverage, outcomes tied to short shifts. And when a shift runs short, the response is documented, just not like a blank line in the schedule. Hey, I tried to call these 5 people. I couldn't get anybody to come in. Make sure there's some documentation that shows what you did. Go ahead, Tyler. Okay, so before we get to our free staffing tool, I did want to read you, because I did promise you, how we get into IJ territory under staffing. So I'm going to read you right from Appendix PP how we can get in an IJ level of territory, because I want you to understand this. So, a resident with a stage 4 pressure injury did not receive skin assessments and treatments for 2 weeks due to the absence of the only trained wound nurse on the resident's scheduled skin assessment days. No accommodations were made for coverage in the absence of this wound nurse, and no other nursing staff were trained to provide this care. The pressure injury became infected during the time frame and resulted in the resident being hospitalized, requiring IV antibiotics for sepsis. Failure to provide sufficient staff with the necessary skill set to provide skin assessments and treatments created the likelihood for serious injury, harm, impairment, or death for the resident. And the reason why I picked that one for an IJ, I consult in a lot of buildings that actually go in, and I see this happening, is they don't have an outside wound team. That's totally fine. That's up to the facility's preference. But then they have one wound nurse. And then the wound nurse is out sick on Wednesday's wound rounding day, or she's on vacation for 2 weeks, and then nobody picks it up. We're writing, in a book for somebody to see the skin and then not addressed, and the wound gets worse and worse and worse. So I wanted just to make sure I brought that out, that it's an IJ level of citation. So what we did at Celtic, we created this F725 staffing sufficiency assessment tool, which you can get by the QR code. And this will just help you. And if you have a copy on this, this will definitely help you. But if you need to do a copy, you can get started here. So you can download this tool. And then I believe Tyler's going to speak to you a little bit about EpiCompliance. Tyler?
Awesome. Thanks so much, Robin. I'm gonna turn my camera back on here. And just about this, yeah, the QR code. I know everybody's, probably pretty familiar at this point. But yeah, you can use your phone. And also, what we will do, if for whatever reason you don't have your phone, if you don't, I'm jealous. I wish mine wasn't at my hip all the time. But we'll also email this out, as well as the slides, as well as the replay and the other 3 or 4 things that everybody asks for at the end of them. So we'll make sure that everybody will have a link in an email that goes out, probably from Celtic and also from us. So awesome. Well, great. I appreciate that. Robin, always, so helpful. You guys let me know, Robin hates this, so I do it every time. So if you guys would oblige me, throw yes in the chat if you've gotten value from Robin, because she says she doesn't want to hear it. It's kind of like nobody likes getting sung happy birthday or something along those lines. But I usually like just showering her and then emailing Maureen and everyone about how much we love her and how great she is. So if you guys, there we go. That's good. That's good enough for me. Thank you guys. Just immediately 75 yeses. Awesome. Well, I appreciate you, Robin. Appreciate you guys. Um, you did a great job as always. Before we're going to go into Q&A here in a second. Before we do that, if you guys have been on the last few webinars, you know that we're trying to collect some information about a new, skilled nursing facility software that Celtic, Maureen, Robin, Christy, myself, and some folks on my team have recently created. So if you did the survey last time, that's fine. We're going to do something similar now. But again, with this whole thing, the reason why this is free is because we're doing this monthly and we have about 300 of you guys that sign up every time, a lot of people that come back from previous webinars, and a lot of people that are new. So we love having you guys, and we want to continue doing these once a month. We feel like the feedback we've got has been incredible, because of how much value Robin's able to give, because she sees this every day, and of course she teaches a lot of the continuing education and different webinars and seminars around a lot of this. So as you guys know, when it comes to compliance, right, the big gap isn't knowledge. Most of the time, it's organizing, tracking, sharing, having everything all together in one place. But what we find, and I'm sure most of you guys can probably agree with this, is a lot of times people are doing things with paper and pen and Excel, and they've got one system or they've got five different systems, and it becomes a headache. It becomes difficult. It becomes more stressful. And that puts more time on your plate and puts more time on your team's plate, your leadership team's plate. And as a result, that trickles down to, everyone, even patient care and things like that, because we're spending so much time, right, pushing paper, so to speak, right? So what we could use your help with is we'd love to just take, 2 or 3 minutes here, show you the software. If you've seen it before, I'll try to make it a little bit different. And then we're going to have you guys, I'm going to send out another QR code and give you guys a chance to win a $100 gift card. So anybody that fills out that survey, it'll take you 2 seconds to fill it out. It's really just more so, what do you like? What do you not like? And it just helps us improve in what we're doing, like I said, and continue to do these for free. And we want to be able to use your minds, because you are the ones that are in the facilities on the day-to-day basis. And you get to see what's going on, and that's really helpful information to us. So last time, I don't know if we emailed this out or not, but Catherine Costello, I don't know if she's here today, administrator at Hudson Valley in New York. She was the one that won it. So please don't drive to Hudson Valley and rob her. It's just a gift card. It's only $100. So I talked to her afterwards about it. So we're going to be giving out another one. It depends on how many people do it. If enough people do it, we'll give away multiple gift cards. So, and we'll announce it coming up on Monday. So, real quick, again, some of you guys might have heard this. Some of you guys, maybe this is brand new, but of course I'll keep it short. We created well, first of all, who are we, right? Who am I? I work for a company called EpiCompliance. We partner with Celtic. Our software has been around for almost a decade, and currently 600 different healthcare organizations use our software. But last year, we partnered with Maureen, Robin, Christy, if you guys know Christy from Celtic, and really Celtic's whole brain trust of consultants, to build our platform that is to do with HIPAA, to do with training, to do with policies and procedures, task management for everything compliance related, and specifically make it for skilled nursing. So we added in QAPI, we added in 60 to 70 different skilled nursing facility tasks. And that way you've got one place that you or your leadership team can log in. We've got all the tasks loaded in the platform, scheduled out by week, by month, by year. So you know what you need to do, when you need to do it, who needs to do it, why you need to do it, right? You've got your F tags, your critical element pathways all in there as well, all in one place. So we're not, having our training on an Excel sheet, and then I've got to go check the policies and procedures in the what we call the giant book of spells in the corner. That's we got to get a feather duster to get off the dust so we can open that up, right? And then we've of course got our task management on a mixture of paper and pen and post-it notes and Excel. So we took it all in one place. And again, what does that mean, right? Like, it's cool having another software, whatever. But it's really having everything tracked, organized, easily shareable across teams or across facilities or to consultants or surveyors. That means over time, right, more higher star ratings. That trickles down to better patient care, less deficiencies, less fines. The big one, as Rob and I talk about all the time, you can't really quantify it, but less stress, right? Hopefully, anybody out there looking for maybe a little bit less stress when it comes to compliance and paperwork, better organization, better census, higher reimbursement rates, better staff retention, fewer lawsuits. Everything's all connected. So I'll show you guys this, real quick in the system. So when you log in, this is what it looks like. So it could be your administrator, your DON, somebody to do with compliance. It could be at a corporate level. It all depends, but you would log in here, right? It's got all of your tasks separated into different categories. So I'll kind of go down to some of the skilled nursing facility ones. Of course, it's gonna log me out there as always. But when you log in, it will go to that page. This will be your overview, and you can click down. This is just the task management piece. And so I can type, what I can do is, they're all broken up into category, right? So we can sort them by billing integrity, quality of care, staffing, right? All of these different things. I'll just type in, like resident call system is an example. But of course, you can go in here. You've got your appendix PP that's easily, you can search through that. You've got your critical element pathways and any sort of associated documentation that you need to complete this task is right there uploaded, easy to access. And this is the who, what, when, where, and why, right? The description of the task, how to do the task specifically, how do we know that it's actually been done and we can move this to completed. And then, of course, all the reference pieces, the F tags, critical element pathways that are associated. So, of course, we can go in here, fill out what we need to, leave any sort of notes, update the status to completed or pending or whatever it might be. And then, of course, we can print out, or download PDFs of where we're at with all of these things, all of our tasks, all in one place. Right now, on top of that, yes, there is training in here. We're not really a training software, but all of the training that you'll need is in here in one place to where you can access training, send out training to your team, send reminders, so you're not having to, hunt down Linda, Susan, Bill, whoever it might be, to get their training done. Everything's all automated through the system. All you have to do is log in here, see where everyone's at, send out new trainings, and all that kind of stuff. So that's your task management piece, your training, also all of your policies and procedures here at the bottom. Forms and policies will all be there. So instead of being in the binder, they'll be there as well. And then the big last piece, of course, this is kind of a higher level overview, but we call this the Compliance Incident Center. I really call it the QAPI Center. This is something that can be used in order to, if we click on one of these as a random piece here, again, we can go in here and see, okay, log what happened, when did it happen, what type of incidents, who's investigating, all of the who, what, when, where, and why that you need in order to, kind of start some of these investigations or QAPI plans. You can list all of the interviews that you did, who was interviewed, what questions were asked and answered. And then, of course, you've got to have your corrective action plan, right? So, what are we doing about it? Who's doing it? Whose responsibility? What is the timeline? What is the deadline? And that way you can track these things as you go. And of course, a couple of things I'll show you here. So, if I wanted to download a report of this QAPI or incident, I could download one here. Let's see if it will. Okay, I was gonna say I don't know if it will, if I'm full screen. So it will print you out this nice little report here. That way you can share with your team, share with consultants, surveyors, whoever it might be. But everything is all here in one place, easy to go. It's easy as downloading a file and sending it to somebody if you need to. But for you, it's also tracked in the system, right? So we can even go back to our compliance incident center here. And all this stuff is, I mean, super easy to learn for you and your team. It's within a day or two, you're up and running and wondering why you were ever doing anything with paper or Excel. Because it's just, everything's easier and easier to track in here. So you can even download your report here. And so this will give us a report. Of course, this is a demo account. So, I haven't filled out all of the information in here, but it will give us here, I'll have to probably go outside of screen, full, whatever it's called here. we'll go actually stop share for a second. And then I'll share my screen there. I think it's because I was going full time, so or full screen. So yeah, all of your stuff will be here as well, right? So you can track in that compliance incident center where everything is. You can pull up all of your reports at once for your QAPI meetings or whatever it might be, right? And so that way everything is all in there at once. So um, and then, so that's the kind of the basic rundown, right, of the system. I'm going to go pull back up the PowerPoint if I can find it. I might exit it out of it. I'll pull it up here. Um, but yeah, so everything is all in one place, right? It's um, you've got your policies and procedures, you've got your training, right, which is great, but also at the same time, of course, you've got your the compliance incident center for QAPI, and you've also, I think the biggest thing is the task management, so it's all in one place, right? So that's the basic rundown, right? So that way you're going from again paper and Excel and maybe one training system and everything all in one place to where you can have your DON, your administrator, compliance team, whoever it is, everybody can all log into the same place and you can in real time know who's doing what and share things across teams. So that's the basic rundown. Like I said, right before we hop into Q&A, if you guys could help me out, if you'd like a chance to win $100, um, if you want to scan this, or what you can do is I'll also put this in the chat for us. If I can find the chat, it always runs away from me here. Um, I'll put this in the chat if that's easier for you to click on. But if you guys could take, like I said, literally it'll take you maybe 60 seconds, maybe 2 minutes. Just depends on how fast your fingers are with typing. But it's just a lot of kind of couple multiple choice questions. So if you guys want to fill that out, and then we'll jump into the Q&A here in 1 second. But yeah, if you guys would fill that out, that would be a huge help to Robin and I. We've both spent a lot of time in as well as Maureen and Christy and a few folks from my team have spent a ton of time over the last year building this really for you guys, the people that are at the ground level. The idea wasn't, hey, here's another software, right? Nobody needs another software, right? There's enough softwares out there, but I don't really look at it like a software. What I look at it is if you have this at your facility, does your life get easier or does it get harder? Do you end up spending more money or do you end up spending less money? Right. And so the goal of this, especially with Maureen and Robin and Christy, who have lived that life and continue to live that life, as far as being on the ground level and seeing day in, day out, what do people need and what do they not need, right? We wanted to build something that makes your life easier from day one. Not, yeah, you've got a bunch of crazy training and this is going to take forever and nobody's going to get on board with this, right? We wanted to make it as simple as possible, right? But as useful as possible at the same time, right? So there's no extra unnecessary bells or whistles or training, right? People that that have already jumped on with us, right? It's usually a couple of hours of training with some of maybe your top people, and then from there, it's the difference of. I always use the example of a horse versus horse and carriage versus a car, right? And in the horse and carriage world, you might look at a car and go, I don't like that. It looks weird. It's kind of loud. Doesn't makes kind of some weird sounds, right? But the first time you get in a car and you go, I cannot believe that I was living any other way, right? So that's really the whole goal behind it. An idea behind this is, we want to make your lives easier. And we want to do that because we know if it takes too much time, if it's too much to train you guys, or it's too complicated or too difficult, right? You guys can handle it, but ultimately, the more difficult you make something, the less it's going to get used, right? So that's kind of the big idea behind it. Before we jump into Q&A, Robin, do you have anything to share about kind of maybe your perspective of the software and how you feel like it might be helpful or anything else?
Well, the reason why I love the software is because it takes all the critical element pathways, which there are a lot, my friends, if you download them from cms.gov, and puts them into monthly tasks. So it doesn't look so overwhelming that you can, as a DNS or a facility leader, you can take 2 to 3 tasks a month and work on those, and then also go with your team and do the policy and procedure that goes with it, so everybody understands what every policy and procedure is, what it means, how to actually do that task, and fill out that critical element pathway honestly, so you can see where your shortfalls may lie, and then you can set up a copy for that or an education. So I like that it's not one large item. We split it over a 12-month period.
Awesome. Yeah. Robin was kind of, of course, a lot of the brainchild behind, some of these pieces specifically. I know that we talked many times about the tasks, the specific tasks, the QAPI piece, and many of the other features, right? So all of this was, we kind of had, I would say, I don't know, 60, 70, 80% of this maybe. But again, we brought in and teamed up with Robin and Christy and Maureen to really say like, hey, you guys know what folks need at the skilled nursing facility on the ground level, right? What would make most sense, and how do they want to see things, and how do we put things in the words and lingo and language that they use and the tasks that they have, right? And so that's why we try to build it with an administrator or a DON or even an owner or somebody at a corporate level, right? This can be used across multiple facilities to track and see where everything's going on at the same time. So